Hi, good morning, Paul. My name is Teresa Brad. I'm your invigilator for the OET speaking session on the 15th of January 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Paul Davis.
And what is your candidate number, please?
My candidate number is 201207532.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Why do you think you are a good nurse and which team you fit for?
I am passionate about being a good nurse and doing all I can to make a difference in the lives of my patients. I am a hard worker and believe in teamwork. I believe I could be an asset to the team of pediatric nurses.
If you were offered a position that requires travel, would you accept it?
I would be willing to travel at times. I have small children and would prefer a position that offers more time at home. While I would not disagree to travel at times. However, if I can support my wife often, it will be great. Also, I would like the flexibility of being able to be home a majority of the time.
Have you ever been in a situation in which a coworker put a patient in jeopardy? If so, how did you handle it?
I actually have experienced a time that I had to report a coworker to my supervisor. One of my peers had a diabetic patient who had an insulin order per sliding scale. The nurse gave insulin to the patient without checking his blood sugar level first. She told me and asked me not to tell anyone. However, I knew that patient safety is the responsibility of everyone. So, I did notify the supervisor.
Is there a particular story about a pediatric patient that was personally moving for you?
There are so many children whose stories are moving to me, even after it has been a while since I've cared for them. One of the most moving, I can say without a doubt, was when I cared for a boy who was a twin. He was terminally ill. His brother stayed at his side night and day. He slept in his bed as much as possible. It was heartbreaking and encouraging at the same time, if that makes sense. It renewed my faith in people and in what love and care for others can really do. That child didn't survive, but his memory will live on forever.
You cannot determine a diagnosis for a patient's condition. What is your next move?
The first thing I would do is consult with a few other pediatricians at my workplace to gain their insights on the matter. If we still couldn't reach a conclusion, I would refer my patient to a healthcare specialist based on their current symptoms. If it seemed to be an emergency matter and the patient was in pain, I would suggest a visit to the ER and offer to call ahead for the parent.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning. My name is Paul Davis, one of the registered nurses working in this hospital ward.
Hi, good morning.
Am I talking to Isabelle's mother, who has been admitted with an ear abscess?
Yes, I am Isabelle's mother.
How may I address you?
You can call me Teresa.
Hi, Teresa. You seem to be very anxious. Is there something I can help you with?
Yeah, I am anxious about Isabelle's stay here in the hospital. I can't be at the hospital all the time, so how is she going to manage that?
Your anxiety is quite natural. I can understand your situation. I can assure you that you will receive the utmost care in this facility. Our children's ward is managed by specialist pediatric nurses, and well equipped with toys and fun stations. All the areas are disinfected regularly, and children with viral infections are isolated from others. Children's wards also have special security services to ensure safety. I can reassure you that Isabelle will be safe and happy here.
I'm glad to hear that.
To make her more comfortable, can I have a few questions with you to collect some details, please?
Sure, what all details are you looking for?
Thank you. May I know whether she has any siblings she usually plays with at home?
Yes, she has 2 siblings, Joan aged 5, and Sam aged 7.
Oh. That's great. Well, now, I require a few details about her normal routines at home.
Okay.
First, may I know her usual bedtime, morning, or afternoon sleep?
She usually wakes up at 7 a.m. During the day she used to take 2 naps. One is around 11 a.m. to 12:30 p.m. and the second nap around 4 p.m. to 5:30 p.m. Night she goes to sleep around 11 p.m.
Okay. Well, does she have any food preferences?
She used to drink milk when she woke up. No other preferences.
All right. Is she capable of feeding herself?
She does, but needs attention.
That's fine. Has she brought any favorite toys or books with her?
Yes, she always carries her favorite doll, Minnie, with her.
Nice. Last question.
You may proceed.
Is Isabelle fully toilet trained?
Yes, but she needs some assistance.
All right, that's fine. We will take care of that.
Thanks a lot.
It's my pleasure, Teresa. So, just a summary of Isabelle's routine. 2 nap times are 11 a.m. to 12:30 p.m. and 4 p.m. to 5:30 p.m. Normal bedtime 11 p.m. to 7 a.m. Drinks milk when she wakes up. Favorite doll Minnie is with her. At last, she needs assistance for feeding and toileting. Is that right, Teresa?
Yes, that's correct.
Would you like to add anything else?
No. It's done.
All right. Thank you for your information.
My pleasure.
Now I would like to inform you regarding the visiting hours. Your visiting hours are from 11 a.m. to 8 p.m. However, overnight stays are possible only in a special visiting room. Do you need any clarifications?
Nurse, are the visiting hours flexible?
Unfortunately, the time is exclusive for visitors. Nevertheless, it's not flexible.
It's okay.
Don't worry about Isabelle, she will be happy and safe here. When Isabelle leaves the hospital, she will be perfectly alright as well.
I am very glad to hear that. Thank you, nurse.
My pleasure, Teresa.
That is the end of your OHE speaking role play. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.